Promethazine hydrochloride. There is a generic available, but it's also sold under the brand name Phenergan. This medication is an antiemetic and an anti-allergy. Common dosage forms include tablets, syrup, suppositories, and injection. The tablets are sold as 12.5 milligrams, 25 milligrams, and 50 milligrams. The syrup, also known as Phenergan plain, is sold as 6.25 milligrams per 5 milliliters. The suppositories come in a 12.5 milligram, a 25 milligram, and a 50 milligram. The strength of the injection is 25 milligrams per milliliter and 50 milligrams per milliliter. This medication is used for the management of perennial and seasonal allergic rhinitis, vasomotor rhinitis, allergic conjunctivitis, uncomplicated allergic skin manifestations of urticaria and angioedema, amelioration of allergic reactions to blood or plasma, dermographism, and as an adjunctive therapy in anaphylactic reactions. For these indications, there is an oral therapy and an injection and rectal therapy. For the oral therapy, you'll give 6.25 to 12.5 milligrams 3 to 4 times a day as needed, or 25 milligrams at bedtime. When oral therapy is not possible, injection or rectal therapy may be used. For this therapy, you'll initiate with 25 milligrams and repeat in 2 hours if necessary. Resume oral therapy when possible. The preferred route for the injection is deep intramuscular. This drug can also be used to treat motion sickness. In adults, 25 milligrams is given twice a day to treat motion sickness. The initial dose should be taken half an hour to 1 hour before anticipated travel, and then again 8 to 12 hours later as needed. For children, they should take 12.5 milligrams to 25 milligrams twice a day to treat motion sickness. Another indication for promethazine hydrochloride is for the control of nausea and vomiting. In this case, the patient would take 12.5 milligrams to 25 milligrams every 4 to 6 hours as needed. Another indication for this medication is for sedation. In this case, 25 milligrams to 50 milligrams is given at bedtime for adults, and 12.5 milligrams to 25 milligrams is given at bedtime for children. These are just a few indications for promethazine hydrochloride. See the manufacturer's package insert if you are unsure of the dosing schedules for children, obstetrical, intravenous, or surgical use. Keep in mind, this medication is on the Beers list. Promethazine competitively inhibits histamine at the H1 receptor site, causing a spasmolytic and decongestant effect. Antihistamines will prevent but not reverse histamine-mediated reactions. The therapeutic effects of promethazine begin to occur 20 minutes after administration and last for 4 to 6 hours. Peak effects are seen 45 to 60 minutes after administration. A few drugs might interact with promethazine. For example, anticholinergics may decrease the effects of promethazine. Central nervous system depression may increase with alcohol and other CNS depressants. Use with metrizamide may decrease seizure threshold, and barbiturates may decrease the actions of promethazine. The use of promethazine is contraindicated in patients hypersensitive to other phenothiazines and in patients with lower respiratory tract symptoms, including asthma. This drug is also contraindicated in pediatric patients less than 2 years of age due to the potential for fatal respiratory depression. The injection in particular is also contraindicated in patients in comatose states and in patients who have taken large amounts of CNS depressants and should not be given by the subcutaneous or intra-arterial route. Used with caution in pregnancy or children and in patients with narrow-angle glaucoma, stenosing peptic ulcers, pyloroduodenal obstruction, urinary bladder obstruction due to symptomatic prostatic hypertrophy and narrowing of the bladder neck, impaired liver function, and cardiovascular disease. Reduce the dose of narcotic analgesics by 1/4 to 1/2 when given concomitantly with promethazine. This medication is pregnancy category C. Adverse effects of promethazine hydrochloride include drowsiness, rash, nausea, vomiting, blurred vision, dry mouth, and dizziness. During patient consultation, you should include the following points. This medication may be taken with food or milk if GI upset occurs. This medication may cause drowsiness. Use caution when operating machinery or when mental alertness is required. Avoid alcohol while taking promethazine. This medication should be stored in a cool, dry place away from sunlight and children. Contact a physician if the above side effects are severe or persistent. If a dose is missed, skip it and return to your normal dosing schedule. This concludes the promethazine hydrochloride drug card.